and welcome to the electrifying 4th edition of After Dark Chat. I am Chadwick Clark, your guide, your host through this realm of knowledge. As a learning and development specialist at the African Caribbean Council of HIV and AIDS in Ontario, ACCHO, we want to welcome everyone. A lot of people want to find out what is After Dark Chat, what it's really about, and what it really signifies. After Dark Chat is a groundbreaking brainchild of myself. And it's really a social media series designed to destroy and to dismantle the different misconceptions surrounding critical subjects in our community, such as HIV, stigma, social determinants of health, and the list go on. This evening, we will be discussing topics such as what can be our next step to care, what is treatment and care, how do I access care. And oftentimes newcomers, they come to Canada and they struggle to navigate the system, the healthcare system, especially as it relates to HIV and AIDS, and how they get access to treatment and care. And so frequent questions are asked like, what's my next step? What do I do? How do I get a family doctor? How do I disclose? Who do I disclose to? When do I disclose? And about different insurance, especially medical insurance. So with grappling with all of this, there's so many uncertainties as a newcomer. And so mental health is also a struggle. Stigma and discrimination is still a struggle. And these are some of the issues we'll be speaking about tonight. And so we aim to provide you with directions, with a roadmap, a compass to find out what's your next step. We'll be talking about some critical topics such as stigma. And so stigma remains a significant barrier as it really destroys people who are living with HIV AIDS. And so we'll be looking at how do we get over it, how do we work around stigma. We'll be looking on linking lives to care. And so we'll be providing information on accessing health insurance, finding a family doctor, navigating the public health service, and understanding the different resources that exist. We'll be looking on U equal U, which is undetectable equal untransmittable. And so we will dive into that and educate persons on that topic. We'll be touching on mental health, which is very important for our newcomers here in Canada. And we'll be giving you a message of hope, message of how people have overcome stigma, overcome trauma, how they have lived comfortable with HIV and how they are navigating the health system successfully. And so we'll be providing those information to you. So tonight, let us guide you towards the next step to treatment and care, providing you with knowledge, resources, and how we can overcome these barriers. So I can't do this by myself, so I have a host of panel with me, and so I'll ask them to introduce themselves. So I'll start with the gentleman on my right.
Hello everyone, my name is Osahan Osawi. I'm a nurse practitioner and I work with a PrEP clinic in Toronto.
Thank you.
Hello everyone, and I'm Novella Tingani, and I'm an ACCHO strategy worker. I'm in Hamilton.
Hello everybody, I'm Fosta Namsoke from Hamilton.
And we have Dr. Jordan that's online, that's joining us virtually. He will introduce himself.
Hi everyone, my name is Dr. Jordan Goodridge. My pronouns are he, him, and I'm a family physician based in Toronto. I'm also a clinical educator, and I'm happy to be here to talk to you a little bit about HIV, treatment and linkage to care. I have additional training in HIV primary care and a very special interest in this area. And so I'd like to set the stage a little bit by talking about what we'll be discussing today. What's my next step to treatment and care? And as a family physician with a special interest in HIV primary care, I've had the opportunity to support a number of my patients from the very beginning, when they're getting tested and when they receive the diagnosis of HIV, to receiving treatment to get their viral load undetectable and untransmittable, a concept that we'll be talking about tonight, of course, and supporting them holistically in all aspects of their health. So connecting them to mental health resources, engaging them with other support groups, in groups that specifically work with individuals living with HIV, either here in Toronto or elsewhere in Ontario, depending on where my patients are located. A lot about HIV care also involves prevention of other conditions and illnesses. So a lot of individuals will be, maybe a bit overwhelmed at first. And so we want to take things in stride, step by step, to engage them in different aspects of care, to make sure they're up to date in terms of things like cancer screening, STI screening, and prevention of illness through things like immunizations. And so today we'll be talking about and focusing mostly on the treatment of HIV itself, using antiretroviral therapy, and get an understanding of what that looks like, how that's actually done practically, and what the results are, why we're so keen on starting treatment early on in order to protect an individual's immune system, in order to help maintain various aspects of their health, and enable to continue to support them in various ways going forward.
And so we will continue to set the stage, and we will ask our nurse practitioner, Osahan, to set the stage for us.
Hey, hello everyone. So I work with the PrEP clinic in Toronto. We offer online consultations as well as a physical location. So we actually have a clinic that we offer HIV prevention, including PEP, PrEP, and PIP. We also offer DoxyPEP as well, which prevents chlamydia. There's evidence for it to prevent chlamydia infections and syphilis infections. We also offer a bit of primary care, but as it relates to sexual health care and testing. We also have a location in Ottawa as well. And we support men, cis men, cis women, trans women. We encourage anyone who wants kind of that kind of HIV prevention care, STI testing, to come over to our clinic and access these services.
And you did say woman, right? Because
Yes.
a lot of persons, as it relates to PrEP and PEP and PIP, thinks it's for men.
For men
only.
who have sex with men,
Right.
correct.
So you're saying that's not the case?
That is not the case. In fact, we do have many women actually accessing our services, cis women, and they can take PrEP. So so it's not only for men who have sex with men,
Okay.
but it's also for women as well, trans men, trans women, whatever the case may be.
Okay.
The only thing though to consider with women is that they need to take it for like a longer period of time, PrEP. So they'd have to take the PrEP for about 21 days before having the first sexual encounter to have the 99% effectiveness against HIV. Whereas men, cis men, would have to take it for 7 days before their first sexual encounter. So we usually call that the 7-day lead-in time before you start taking the PrEP, or the 21-day lead-in time for cis women.
Perfect. Novello, you are over there in Hamilton as our strategy worker.
Yes, I am.
What is the atmosphere there as it relates to navigating the healthcare system, especially with newcomers who would have maybe just found out about their status, that they're HIV positive? How do you help to navigate, and what your organization actually offers?
Okay. So the Positive Health Network has been around for about 30 years. So what we've been doing for the most part is that most of our clients have to go through intake system, then meet with our support worker, and we also work closely with the SIS clinic. So it's like the specialist HIV clinic that we work closely with, and they do the referral, and they come. So it depends on what program they may be interested or how they identify. If they identify as an African Caribbean Black, then they're definitely coming to me, to my program. Or if it's a man that has sex with men, then they'll go to that specific program.
Okay.
So after they do the whole intake process, we meet them where they're at. We see what's their first needs, right? We have to look at all the social determinants of their health and where they need the most help with.
Okay, perfect.
Yeah.
And so you cater for everybody, and if you particularly don't really offer the service, I mean, you already do referrals.
Yes, definitely.
Right. What if they don't have insurance?
So we do also work with newcomer refugee centers. There's a lot now in Hamilton because there was a huge number of newcomers coming into Hamilton. So that's what we've been doing. We will send our referrals to them and work closely with them in terms of programming as well.
Nice.
Yeah.
All right. So I will jump over to my next guest. Fosta, how are you?
I'm good. How are you?
I am well. How has it been, your journey coming to Canada? I mean, tell us a little bit more where you're from, how long you've been here in Canada, and what the experience have been so far.
I come from Uganda, that is Africa. I'm now making my 7 month. Yeah, 7. Because I came in November.
Nice.
Yeah, when I reached here, you know, it was by the time I was going, by the time I was preparing for my travel to Canada, I thought of my medications.
Yes.
And I thought like, how will it be? Because I'm going to be new to Canada. How will I access the, you know, the hospitals? How will I tell people that I'm HIV positive? Like, it was a little bit hard for me, but I had to find a way out for myself. So I went to the hospital where I used to get my drug. I told them that I'm going to travel, but it's going to take a while. So I need at least some medication will take me a little bit longer as I'm searching for a way out to get my medication when I reach there. So I come with my medication. Reaching here, you know, I reached here, I went into a shelter. So by the time you reach that shelter, they ask a lot of questions. Are you taking some drug medication? Are you okay? So first I shy away from that I take medication. How can I tell these people that I do? But then I kept quiet for that. But it took me like 2 days. I said no. So when it gets finished or what, I'll need to get yeah. So I called my caseworker. You know what? I want to talk with you. Then I tell you what I didn't tell you. So she came, we talked, and I told her, you know, I'm on medication. I'm taking my drugs. Like she told me, okay, it's fine. So I told her, but I want to know what happened. But before that, I had to go to the immigration doctor. They had to do that checkups. They do. So the form they give us, I remember when they gave me to, like, are you HIV positive? Or that's I skipped. I didn't take it. I said, okay, let me just say, okay, the blood checkup will tell you. So let me just share away from that. I didn't. So when it was a week, then they emailed me that there are some parts you didn't fill, so you have to come back. We do those tests, the HIV, and it was what else? It's out of my head. So I had to go back to Oakville to meet Dr. Alex. So we did. I told him I did this intentionally. I didn't want to. I just wanted you to prove whether I am. So he told me, it's okay, don't mind. You're not alone. People are like, because I thought like if I say that I'm HIV positive, I'll be like neglected, all like telling me to go back home where I don't want. So I thought of many things. That's why I was shying away from it.
So quick question, when you had to disclose to the support worker because your medications were finishing, you needed a refill, and so you found yourself between a rock and a hard place because you're so maybe used to the stigma back home, you're not knowing who to trust. What was going through your head when you had to now open up to this particular person? How was that experience?
After, because I thought of what will happen if I don't like tell these people that I'm on medication. So because now I thought if I hide that, time will come when my medication is done, and of course it will be on me. Yeah. So I said, okay. But we had that policy that if your information is confidential, it's known it's known by that person you talk to. So that's what I thought of. Yeah.
Okay, lovely. I just asked our live audience who is with us if they have any questions so far to throw to either of the panelists. We have our nurse practitioner, we have our strategy worker from Hamilton, and of course, we have our guests with lived experience. Is there any particular question that you would actually want to ask any of us? And I see a hand there. Go ahead.
Awesome.
So you said you had a question. Go right ahead.
Thank you so much. My name is Matthew, and my question goes to the practitioner. You say that for PrEP, ladies, you have to take for 21 days,
Yes.
while gentlemen, you have to take for 7 days. So I'm really curious,
As to
what brings about the difference? Is it genetics? What brings about the difference?
Thank you very much for that question. That's actually a very, very good question that I wanted to expatiate on, but I didn't, want to take too much time. But so the reason for the 21-day lead-in time for cis females is that if they engage in vaginal sex, the PrEP, so the HIV PrEP, it takes about 21 days, and it's been studied. It takes about 21 days to reach the vaginal canals, and for it, to be effective. Whereas for males, primarily males who engage in like insertive sex, or like in insertive anal sex or receptive anal sex, it takes about 7 days for the drug to actually penetrate through their rectal and through their penis. So that's pretty much why. So it's more of like a biological thing.
Thank you so much.
You're welcome.
I'll hop over back to Novello. What other resources you offer that's unique to your area in Hamilton that's not maybe readily available, or is there PrEP clinics there too?
So we do also have PrEP clinics in Hamilton. And then in terms of like resources, we like to create like for example, if it's like cultural specific programming, we'll create the resources. We'll even have like a focus group
Nice.
to get it from the people to what kind of resources are they looking for.
Okay. What's the mental health status like when we interact with our newcomers? Like, are they still shy to take on some of these programs, some of these resources that you offer out there?
Funny enough, I see women, like I host a specific like ACB program where it's just like a social group of like ACB folks that come through it. I see majority women. I don't know what it is, but I don't see a lot of men when it comes to like programming. And I always feel like it's some kind of fear or it's like ego. I'm not quite sure where it stems from, but in terms of programming, you see more women than men. And for their mental state, a lot of people be going through like depression. I'm not an expert in that sense, but they do voice their opinion to say they're going through like feelings that they're experiencing for a long time, just feeling isolated, coming to a new country, they just don't want to get out of bed and having a hard time getting that work permit.
Okay.
Yeah.
Fosta, I go to you. As it relates to stigma, how has that been a reality here? Have you faced any discrimination, any stigma because of your status?
I will not lie. I've not experienced anything like that. Yeah.
Perfect.
I've been treated good. So far, the places I've been in, I've been welcome. Yeah.
And
I've
that's,
not experienced anything like stigma.
and that's a significant difference from back home, right?
Yeah, it's too different.
It's two different
Yeah.
things. And so you encourage your sisters and your brothers out there, those folks out there, that it is not as bad as what they maybe think when they're just coming to Canada.
Actually, I would say that it's the best way or a good thing to live here. When you're HIV positive, you're normal. You're like other people. You do share, you get friends, you share everything like normal. It's normal. Yeah.
It's normal.
Yeah.
Thank you. I see a hand there for the next question. Go right ahead.
Thank you very much. My name is Prosi, and my question goes to Esther. Yeah, Esther, I know As much as you said that you didn't experience stigma, but it is very common to experience internal stigma as an individual. And I would like to know, how did you personally deal with that internal stigma after testing for HIV? And how has been your family, your friends supportive in this journey?
It's a good question, but you mean the back home or here?
Your life journey.
My life journey.
Yes.
I will not talk much of that because I've not experienced that, because by the time I was detected HIV positive, I talked with my family, actually my sister. I told her that I'm HIV positive, but by that time I felt like the end of the world has come to me, because the first medication I got, I threw it in the toilet. Like, okay, let me die. I don't feel like I want to take this. It's too much on me. But my sister came to me and told, because I spent like a week crying, knowing that I'm HIV positive. I felt like I'm going to die. But my sister encouraged me and told me, you have your kids. You have to live. You're still strong. So when you take this medication, you're going to live longer and longer. So don't be discouraged, like you're not alone. So when you go to the hospitals, you're going to find many people you don't even expect. They're living, but if you don't take this medication, you're going to... Actually, every morning she was like calling me, are you fine? Are you okay? Are you good? Have you taken your medication? So she was like on my side. So I could not say that I got any of from my family and my friends, no.
I have a quick follow-up question. So, would you encourage others that are watching us tonight that it's important to have that friend or to have that family member to be in your corner, to encourage you, that you can share with? Some people might call it an accountability partner.
Yeah.
You know, do you think that's very important?
It's very important because everybody in life needs a support, a friend. Actually, a friend, how can I term it? Needs somebody you feel like, okay, I'm open to her, I'm open to him. Even if I tell her, you know, out of experience, I got my sister, she's my big sister, but I'm open to her. Even if I get something, even if I do anything stupid, I can tell her, you know what, I did this, but I don't know how I did this.
Yes.
You know, we chat and talk. So you have to get a friend who can understand you, you can expose yourself, everything, all dirty or good or bad, and she can be, or he can be there for you. Yeah, that's what
Powerful. Yeah.
Asahan, I have a question here online for you.
Okay.
Right? It says, what tips can help someone navigate the HIV medication route on a daily basis? And I guess really they are making reference to the PrEP, right? Because they know it's a daily occurrence where they have to take it. Like, how do you encourage them to keep that routine?
So is it for like antiretroviral drugs or the PrEP, the HIV prevention drugs?
I'm thinking it's HIV prevention.
Okay, yeah. So with that, so we often recommend like setting it up, like perhaps setting an alarm like on your phone, right? So you can, time it like maybe like 8 o'clock, like every morning. Set it so that you remember to take your medication.
Right.
We often encourage people like who are traveling to plan ahead, make sure they have enough pills with them so that they can take it with them.
Right.
And we encourage patients also to use like those pill organizers, right?
Right.
To kind of put it in like Monday to Sunday. This is my dose. And I think the biggest thing is that we tend to encourage people to use to tie taking their medication to like a daily routine.
Right.
So if like you brush your teeth every morning, right?
Yeah.
Maybe have it in front of your, bathroom sink, right? On top of there, so that you can take it after you take your brush, or after you have your shower, or after you have your morning coffee, so that you tie it to like a daily routine, right? That you do, and it kind of helps with you remembering
Right.
it.
I hear you saying yes. Is that something that
Yeah.
you do? You tie it in
Yeah.
with a daily routine?
You know, out of experience, I'm so happy and honored when I came here in Canada. I was talking back home with my sister.
Yeah.
We're talking because we're both HIV positive, so we're encouraging each other.
Right.
So we're talking, but my sister, you know what? By the way, back home, the medication we're given is one pill, but very big. Swallowing is a problem. So whenever you think of swallowing, you say, oh my God, I wish I can skip it. But all my life, I have to live longer. So we were talking with my sister and say, you know why, my sister, what if I hear people talking about injections or what, but you know it's hard to take these pills every day. Whenever you think about what if you miss, and like say, yeah, we're giving hope that injections are coming. But when I came here in Canada, I'm so happy and like honored to. When I was talking to my doctor, we had a conversation of you know what, doctor, I feel like I'm tired of taking these pills. It's too hard for me, but good enough. The pills they gave me, the one I was switched to, were a little bit smaller than the one I was taking. So it was a little bit a change, and I was happy for that. But still, I told him, you know what? What if I switch to an injection? How does it work? Is it good? So he told me, okay, let me first follow up with this medication. Then after you will switch to the injection. So after the time I took the medication and time came, I switched to the injection. I'm loving it. I'm happy. So I don't even get what, oh, I've missed my dose. So I just keep myself, no packing, no what. I'm just happy for that.
How long does the injection last for? How often do you have to?
It's for the first time you're given 4 weeks, then you go back. No, 2 weeks for the first injection, then another one 2 weeks, then you go for the 4 weeks. That's 1 month, all right?
Right.
Yeah,
Once a month?
yeah, 1 month.
So
yeah.
1 month.
Yeah, but it's good. I've not got any
No side effects.
no side effect. I'm happy living. No worries about forgetting my pills or what. So yeah, it's so nice. Yeah.
Nonetheless, as a strategy worker for ACCHO, they have campaigns all the time. And so this campaign that they're currently running is entitled Linking Lives to Care. How do you embody that initiative and how do you translate that into what you do on a daily basis, just linking lives to care, and just speak somewhat of the campaign so far and how you would have used that as a tool for the community members in your area?
I'll definitely say the campaign came at a great time. It's really good in the sense that when we're meeting our clients, like I was saying, that we see where they want to start, right? It's all about where they want to start. Because there's some folks that you're mentioning that medication is hard for them to take. So if they're seeing a doctor, even at the Positive Health Network, we have a doctor coming in who started doing the injections as well, right? So it's been so easy of like our client just coming in, and we try to even schedule for folks that are working overtime or like after hours and on the weekends, and he comes like once or twice a month to do that kind of stuff. And then in terms of other linking people to care, I mentioned the SIS clinic. They also do like workshops, and we also work closely to ACCHO, so just linking folks to their needs.
Here.
Yeah.
That's lovely. We have Dr. Jordan online as well, and he had some questions that were asked specifically to him from our audience online and some of our in-person audience as well. So we hop over to Dr. Jordan.
So the first question we received is, are there specific healthcare providers or clinics that specialize in HIV care? And the answer is yes. Here in Toronto, for instance, we have the St. Michael's Hospital Positive Care Clinic, as well as the Toronto General Hospital Immunodeficiency Clinic, which have both been doing this work for decades. But there are a lot of other clinics as well, including primary care clinics, where we have physicians who have maybe additional training or experience in providing care to individuals living with HIV. Some examples include the Church Wellesley Health Clinic, Another example includes the Maple Leaf Medical Clinic, for instance. And there's also general clinics that do things like testing and treatment that also can help link you to care. So a good example here in downtown Toronto is ACCHO Toronto, which is a sexual health clinic that actually provides a number of holistic health services and links patients to care depending on their health needs. So if you attend one of these clinics, they can actually help you to navigate the system after a new diagnosis. Another example includes the Hassle-Free Clinic here in Toronto, or one of our other sexual health clinics. So there are some options, and in order to find some of these options, you may have to do a little bit of digging online, or you can connect to certain organizations like PWA or the Peoples with AIDS HIV organization. There's ACCHO, the HIV/AIDS Legal Association as well in Ontario. There's ACCHO, AIDS Committee of Toronto, as well as a number of other groups who can help support you in finding resources that may be beneficial regarding your HIV care. I'd also like to put a plug in for the Ontario HIV Clinic Network, whose website actually lists a number of different resources, including clinics that specialize in HIV care, in order to help ensure that you receive the care that you deserve. The next question was, what are the new testing guidelines in Ontario? And so in 2023, the Ontario HIV Clinic Network also released some guidelines recommending routine and regular testing, particularly for groups who have higher vulnerabilities of acquiring HIV. Groups like men who have sex with men and trans men, as well as individuals with other risk factors like intravenous drug use and so forth. And in these guidelines, they often recommend testing every few months. So every 3 months, if you have new sexual partners, particularly if you have multiple sexual partners, if condoms aren't being used every time or not used at all during sex, and so forth. So just being aware of that is important and helpful. And knowing your status is important, because if you are able to pick up and detect HIV early, we can maintain an excellent immune system and get you linked to care right away. Regarding linking individuals to care, the next question we received is, what should I look for in a primary care doctor if I'm living with HIV? And what I'd say is, reflect on what experiences were positive in the past with healthcare providers who you've engaged with. What were they like? Why did you connect well with them? Or what did they provide for you that felt good, right? Were they empathetic? Were they willing to spend extra time with you? Were their hours more flexible, meaning that you could drop in or change things last minute, right? Or maybe you have certain preferences for your healthcare provider. Some people feel more comfortable if they share a racial background, a gender identity, etc., or who emphasize that they have particular comfort in managing specific health conditions, HIV or otherwise, that you may have. It also depends on whether you want your HIV care itself to be managed by a primary care physician, in which case you may seek out individuals who have specific training or experience in managing HIV, or if you're comfortable attending a specialty clinic for this care, in which case you may find a family physician who you connect with in other ways, but they don't necessarily need to have specific background training in HIV outside of the general training that we receive as family physicians. Really, the most important thing is that you're comfortable with your healthcare provider, because that will influence how you engage in care, how willing you are to see this provider, to attend appointments, and again, considerations like flexibility, depending on your schedule, depending on other life considerations, is important to recognize. I'd also like to make a plug for a resource. If you Google Rainbow Health Ontario, you can find service provider directories, and some of the service providers listed there specifically advertise that they have comfort, knowledge, experience in working with individuals living with HIV. The next question is, how can I navigate the healthcare system to ensure continuous and comprehensive HIV care? So I think similar to the last question, I'd really encourage you as an individual to reflect on what barriers you've had in the past in terms of engaging in care, in navigating the system. Are you the type who would benefit from having all your care done under one roof, right, with a primary care physician? Or are you someone who needs to receive care close to home because of concerns or considerations around transportation, around finances, thinking about what these barriers are depending on where you live and what your unique circumstances are, because that will help you to determine what your priorities are. Really what we know is that it's a two-way street, right? We need healthcare providers who are engaged with you and who actively encourage you to ask questions about whatever you may have questions about, who will do education with you, who will sit with you and take time. But again, we need you to feel comfortable in engaging with your care and your healthcare provider. So think about those things when you're choosing a care provider going forward. The next question is, how accessible is PEP, or post-exposure prophylaxis, versus PIP, which is essentially PEP in pocket? And what are the barriers to client follow-up and adherence to PEP? So post-exposure prophylaxis is a group of medications, specifically medications active against the HIV virus, that can be taken for 28 days after potential exposure to HIV. And that helps reduce the likelihood of acquiring HIV. And so you may, for instance, have an episode of unprotected sex or condom breakage, or you may have shared drug equipment. And then within 72 hours after that, you may go to the emergency department in order to receive this treatment. Now, there's certain barriers, like the cost associated with this. So if you don't have private insurance, you may be connected, for instance, to a social worker who can help navigate this. But this is something that generally is available in any emergency department by any emergency physician. And so I'd keep that in mind, again, as an option to access within 72 hours of potential exposure. In contrast, PEP in pocket, or having these medications with you so you can start the 28-day regimen, if you were to have a condom breakage, not use protection during sex, etc., that may be a bit more difficult to access. Usually it would be a primary care physician who feels comfortable, knowledgeable, and able to educate you on what to do if you were to start this, when to connect to care, and what follow-up would look like. So hopefully that kind of answers some of that question. PEP is usually pretty well tolerated. There may be some usually mild medication side effects, like you could get with other medications, things like headache, things like nausea, sleep disturbance. Usually these are short-lived and will go away as you continue treatment. The next question is, what can someone newly diagnosed expect once they have tested for HIV? So it's important to know that HIV, like other particular infections, sexually transmitted infections and whatnot, are reportable to public health. So what that means is that the public health agency, here we would have Toronto Public Health follow up with you, but there's different public health units within Ontario. They would be informed of the positive test result so that they can connect with you, they can do some of the initial education, and they can also help with what we call contact tracing, which is calling or informing previous potential individuals who are at risk, let's say sexual partners, or individuals who may have shared drug equipment with, so that way they can get tested and they could be treated if positive, and again, have positive health outcomes that can arise from early detection and treatment. So that's the main thing to be aware of, is that it is automatically reportable to public health, although there are specific clinics, and you can Google this, that offer anonymous HIV testing. The issue is that if positive, then you would usually be entered into the nominal system, or in other words, the kind of regular routine reporting system that we use. But the benefit of public health being informed is that they can also help you to navigate the system, can connect you to resources, might connect you to HIV organizations who can help, for instance, with things like navigating the new diagnosis, starting on medications, getting drug coverage if you don't already have it, right? And what that might look like. We recognize that a new diagnosis can be a shock. And so we take things one step at a time in order to holistically care for you going forward.
Thank you so much, Dr. Jordan, for that. We really, really appreciate you answering all those questions. And we'll just go to the audience to see if they have any final set of questions for each of the panelists. And I see a hand at the back. Yeah, you could stand and let us hear you.
The question that I have is for my sister from Uganda, Chadondo, Science Okulaba. So my question would be, I've seen on the IRCC portal that, of course, medical is mandatory.
Yes.
And they clearly specify that in case you're found not to be fit, that means your status is not okay. It can affect your claim or your request for a work permit.
Okay.
Have you had any challenges in that sense, or you haven't reached that bridge as yet? Thank you.
Thank you, my brother. I think people talk through, how can I term it? Ignorance. They don't know what they're talking about. Because when I went to, you have to take those, like when I went to the immigration doctor, I was checked up. They know that my status. I got my working permit and I'm working now. It didn't even take me long. Yeah, I'm working and I have my permit.
Nice. And that's something, and that's something that we need to celebrate, you know?
Yeah, I'm working. I have I got my permit. So nothing. Maybe they're talking through, they don't know what they're talking about.
Yes. I see some more hands. I see two at the front, Hassan. I see two at the back. Questions. I see four questions there. So as the mic rotates to you, you can just stand and ask your questions.
My question goes to Namvero.
Yeah.
What are some of the tips that can help someone integrate their HIV medication routine into their daily life?
I'm sorry, I didn't hear the last part of the...
What are some of the tips that can help someone integrate their HIV medication routine into their daily life?
Okay, I'll bite off what you said. So just having those visible reminders, like having the medication in front of you or with you, setting the alarms, pretty much. Integrate, like you were saying, make it part of your daily schedule once you're done eating, or if it's better at night, because there's some folks that take the medication at bedtime instead of in the morning for different reasons or side effects.
Nice, thank you. There are two questions at the front there, at the extreme front. The two ladies at the front, yeah.
Thank you. So my name is Florence and I'm from Black Hat. My question is to the nurse. So what are some barriers that patients face when accessing medication?
That's a very, very good question. Much like, your story, right? Newcomers, especially, immigrants who are coming to the country, have no kind of where to find money, to access medications or even to see like a doctor, like they don't know where, to start from. I think some of the barriers, is kind of not knowing enough resources, I think. Also, I'm thinking that they need money to buy, like their medications, because there are government programs and like drug manufacturer programs that actually fund the antiretroviral drugs, right? And there are clinics like the PrEP clinic that help support clients who are experiencing these barriers, right, in accessing healthcare, accessing, free medications, right? And we have a team of dedicated pharmacists that are very good and very nuanced and very creative in finding funding, like government funding, trillium benefits, all of these kind of like unique funding to support clients and their medications, because it can be very expensive. And I think that's preconception that a lot of people have, that how am I going to pay for these medications if I don't have, like, if I'm not working, like I don't have coverage, maybe I'm on, you know, Ontario Works, like I'm a new immigrant, right? So the PrEP clinic, we have like a whole team that helps these types of clients. You know, we have counselors on our team. We have a dedicated social worker as well that helps to support newly diagnosed HIV, people living with HIV. So,
Perfect. Thank you. And I see a next hand there.
Hi everyone. So my question is for my sister from Uganda.
Yes.
You shared that you have huge support from your sister.
Yeah.
And that's amazing. But in terms of peer support, have you accessed peer support from your community? And if yes, how was that?
I will not. I've not got any of that kind. So because like I disclosed to my sister and my family. So like the other people, no. So I have no experience with that. Yeah.
You recently joined the women's group.
Yeah.
Where you meet other women too.
Oh.
You share experiences there too.
Okay. You mean the one with Kelly?
Yes.
Okay. Here.
Yeah, you can share.
Okay. So when I came here, I was my caseworker, after telling my caseworker about my status, so she introduced me to a lady called Kali, works with Navera. So that lady was so good to me. So we have groups in Hamilton for ladies living with the HIV positive, but we happy, we hang out, we share ideas, we help each other in everything. So it's a good experience for me here, because I was not expecting it, like I will be just alone, no going out, not talking to anybody. But when I felt that women group, we talk, chat, and share ideas. We talk about our status, how we move, how we do this and that. So it's a good experience. Yeah.
So answering that question, I mean, peer-to-peer actually really supports each other, and it's a good feeling, right?
Yeah, we support each other. We do go hang out
and stuff.
We chat, have fun. Yeah.
Perfect. And so I'll ask Nobelo to just give we have one more question, and that's directed to
Thank you.
all right, go ahead.
Oh, I didn't get it.
Thank you very much. Yeah, switching from one medication to another always comes with a lot of anxiety. Switching from one medication, one regimen to another always comes with a lot of anxiety and fear.
How was that for you? Like, thank you so much for the question.
And that is not my question. I'm just giving a background.
Yes.
Because I've had so many of my friends being switched, especially the newcomers, from the medication they were taking back home to a new medication here in Canada. So it comes with a lot of anxiety and fear. So I would like to find out from our nurse, how do you support patients in managing the side effects of antiviral therapy or antiviral medication, just in case they experience side effects?
That's a very, very good question. I think, first of all, by like educating them, right? Like when we start these people living with HIV on medications, I think it's important to provide them the education that there may be side effects, right? And things like, dizziness, nausea, like stomach upset, headache, maybe feeling a little bit tired, right? And that letting them know that most of these side effects are transient. So they initially, when you start it, they come, and then as you continue to take the medication, it kind of dissipates as time goes on, right? And then just letting them know that you could try it with food, right? Maybe alternating the time of day that you take it. And we kind of like we ask these types of questions in every appointment. So we follow clients along to see if the side effects are getting better. And usually in most patients, it's actually well tolerated. I know.
And on addition to that,
Yeah.
my first experience switching from the pill to the injection, I was told by my nurse that, you know what, it's so painful because it's a big needle. So it takes time, it's so painful. So I was strong enough and I told her, you know what, I'm a strong woman. That's what I feel like. I have to switch to an injection. So whatever comes to me, I'm ready to face. So I was expecting that a lot of pain because I was told that it's so painful, it's a big needle. So I said, okay, but I have to go for it. Because they asked me several times, are you ready to switch to an injection? I said, I'm ready. So I got that pain, but it was not too much. As ladies, you know, we give birth to kids. So I say, okay, this is not too much as they say, but it's okay now. Because at first I got the experience of that pain for 3 days, but now for the second time, it was normal as normal injections. So yeah.
And that's what we like to kind of promote, right? Like letting clients know that as time goes on, you will get used to it.
Yeah.
And kind of doing that sort of like supportive counseling, you know, to yeah.
Thank you. And so I'll ask Novella, just to give your closing remarks, what you'd like to leave with the audience, leave with persons in Hamilton, and just in general, as it relates to treatment and care and how that looks.
I just want to say that we're here. Come to Hamilton. We do serve Hamilton, Halton, Halton, Norfolk, and Brant, so you'll find us. And there's always someone that's going to help you. We'll always be there. And it starts now. And look out for other strategy workers within your regions. If you're not sure where to start, check out 411. That's a great start.
Thank you. And Asahan, now what final message you would like to encourage our African Caribbean Black folks as it relates to PrEP, Hep, PIP, and just the services that you offer?
Yeah, sure. So I would say the African Caribbean Black community, I think this is one area where I think there's this stigma, right?
Right.
As Black people, we think that, oh my gosh, like, you know, whether it's fear, right? Some of it, you know, could just be lack of knowing, you know, that these resources exist. I think just we want to promote the African Caribbean Black community to come to our clinics to get tested. Testing, like I want to emphasize testing. Testing is important, right? Just as Dr. Jordan shared, you know, the routine testing I think is so critical. We have a number of different tests. We have the rapid HIV test, which is really, really quick. You get your results in a few seconds. And we also have the standard blood draw test that goes to the lab. We have, within our clinic, we offer, you know, PrEP, PIP, PEP. We offer routine sexual health testing as well too. So we encourage people, whether you're a new immigrant, whether you're, you know, you don't have a family doctor, whether you don't have a health card, you don't have anything, come to our clinic and we provide these services to you. If you are a man, a woman, a trans man, a trans woman, we see everybody and we, you know, treat everybody equally and the same. So we're located on 180 Bloor Street in Toronto. We are super accessible. So we have like online consults. I mean, you can book to see like a nurse practitioner over the phone. We're super convenient. You can text as well, right? So we try to limit those barriers, you know, that exist with like the traditional family doctors and clinics, right, that are out there. So we just want to say that we're super accessible. Find us online. We're prepclinic.ca. And we offer like a range of services. So I can't even talk about all of the services we offer because it's just so much.
Yes.
So
thank you so much, Asahan. We really appreciate you. And thank you, Novella. And continue doing the amazing work that both of you are doing. Thank you so much.
You're welcome.
Yes. So that's a wrap with segment 1. And so joining us next, on the next side, are some beautiful set of panelists. And so see you over there for segment 2. Welcome back, everybody, to the second segment of the After Dark Chat, episode 4. And I'm even excited from the first one now to the second segment. It is just amazing. And so some amazing persons have joined me on set. You'll see one other familiar face. But I just give them the opportunity to just introduce themselves. And I'll start with the lady on my far left.
Yeah. Thank you, Chad. Irene is my name, Irene Wanyoto. I go by the pronouns of she, her. I work as a social worker, case management at Women's Health in Women's Hands, a community health center in Toronto. And I also serve as a strategy worker for ACCHO, Toronto Central.
Thank you so much, Irene. Thank you for joining us. And and everybody know this famous face already from segment 1. So we'll skip and we'll hop right over to the lady next to me.
So hi everyone, my name is Natasha Lawrence. My pronouns are she, her, and Natty, and I'm a community health worker and a certified HIV tester at Women's Health and Women's Hands Community Health Center in Toronto.
Thank you. And then we have...
my name is Derek Kawesa from Care Community Connections in Newmarket. I'm the ACCHO strategy worker. Yeah, we are found at Leslie Street, Newmarket, 1717665 Leslie Street.
Thank you. And thank you for joining. Thank you, folks, for joining us. And I want to start with Natty. We're looking on treatment and care and how we link newcomers and our community members or African Caribbean folks to services, to care. How does that look like in your area?
So in my area, I would say it's really important that we center the needs of the community by going into the community itself. For example, the testing that we offer, it's a rapid point of care anonymous HIV testing, and we're able to conduct this testing in a variety of different community settings. So it's really important for us to go where people are at, and also ensuring that we're collaborating with various different organizations that many of our newcomers may come into contact with.
Okay, nice. So you're meeting them where they are.
Yeah.
And again, because of stigma, because of discrimination, you have identified that, know that that is a sore point, so you're going out there in the communities.
Yeah, it's really important because, for some folks, they may have fears around coming to access services at certain at aid service organizations or certain locations where they think they may be identified, right? Or they may think that, I know someone that works there that's from my village back home or from my town back home. Mm-hmm. I'm worried that person may, tell folks about my status or know about my status. So it's really important for us to build trust, not just within the organization, but outside in the community as well.
Nice. Irene, I know that you have been in this sector, in this work for a long time. You will have experienced the highs and lows of this sector. You serve mostly women at Women's Health and Women's Hands. How is that experience like as a strategy worker working with these folks head on? How is that like for you?
Basically, my role is to make sure that African, Caribbean, and Black folks living with HIV/AIDS are connected to comprehensive care because we work collaboratively with health providers and other service organizations that provide healthcare to our HIV-positive Black communities. So we just make sure that every Black woman living with HIV/AIDS is accessing comprehensive health care, getting all the supports that they need and deserve, and making sure that they're connected to the resources that are available in our Black communities.
You did say comprehensive health care, right? And so we know the barrier with insurance and how that works. For newcomers who want to access medications, who wants to get tested, who wants support, but have no insurance, don't have a family doctor, how do you navigate that?
Oh, that's a very, very good question. Because Women is Health in Women is Hands Community Health Center provide comprehensive health care to not only newcomers that do not yet have the interim federal health program that supports them to access medication, but also supports undocumented folks, like people who have been here and all their statuses have failed. So we see people without status and precarious health insurance. So throughout people when they arrive to Canada and people who have lived in Canada, like the ones we call seniors, but without, we know that we are living with so many people that are undocumented, we still provide medical care to everyone that does not have status in Canada.
Lovely. How was it for you? I mean, knowing that you didn't have insurance, right? You realized that you needed a family doctor. How was that process, navigating you to a family doctor?
When I was done with my immigration checkups,
Yeah.
I was referred to an SIS clinic. So when I reached there, they followed up and I received I got a family doctor. So it was not hard for me.
Mm-hmm.
Yeah.
So they would have linked you to the clinic, and then the clinic would have done the assignment to a family doctor.
Yeah, they referred to me to a family doctor, so I didn't find it hard.
So it was a smooth process.
Yeah, it was smooth. Yeah.
Derek, how are you doing?
Great.
Being a strategy worker, you would have seen a lot of folks in our African Caribbean Black community. What are some of the direct needs as it relates to and the linkage to care in your community? What you have seen for the short time that you have been in this space, what has that been like for you?
Well, first and foremost, there's a lot of stigma, I'll say, and having safe spaces for people to open up,
right,
to have these conversations, it's not really common.
Right.
Yeah, so it takes, as a strategy worker, you must be really open to provide, assurance to somebody. I stand with you. I'm gonna support you in this. So there is the challenge of that people do not want to open up, and then some do not know where to find services.
Right.
Yeah. Now, like for example, York region, where I am situated, it's a very versatile land. It's so big.
Yes.
And it has, and then the ACB community is scattered all over the region.
Yes.
So like you can, you travel a long distance to find them. So you find like they do not have any access to services, and then it's not even a conversation that they want to talk about at times. So it's a challenge that I have to actually carry on, to make a sensitization about the services, about the services we offer and how we can reach out to people where they are at.
And what are some of these services? And you mentioned stigma, right? Being very rampant and very evident in that region. What kind of service your organization actually have to cater to those stigma, to dismantle those stigma and just to be there for the African Caribbean Black folks?
Well, I think I must mention that CARE Community Connections is number one organization that serves one self-testing kits for HIV, like in all the region.
Right.
And so we are open to having these conversations and then letting ACB community to know that we are open to this. Like we're here to support. So that kind of approach is, is calm and kind. I mean, we are introducing a new conversation that didn't happen actually there.
Right.
So we are, it's a great work. It's, it's not, it can be achieved in just a month or something. So the approach is on, and then we're looking up to them. We talked to them recently. We were done in Georgia. To still see that we reach out to the community to actually let them know that these services are here, and these topics can be actually talked about.
Of course.
So like our organizations, we have like individuals that are trained and well qualified to handle these. Stigmas, to go deep in these conversations that people don't want to talk about
Right.
up the north. So like it's great work down there.
Of course, great. Natty, Derek mentioned stigma, and with stigma comes a lot of mental challenges, right? Because it's the fear, especially coming from villages, as you said, or from the community, from back home. How in the community, as a community worker, do you help with that mental health piece of things?
Well, I think it's important to always remember that we're working, like our work is mainly situated within HIV prevention and care. We have to look at the whole person.
Yeah.
We have to think about all of the different factors that may be impacting their lives and may be creating barriers and may be creating issues around mental health. So I think it's really important for myself to first meet folks where they're at when it comes to that piece.
Right.
And it's also important to create space for folks to be able to share some of their experiences. Working with peers has been really helpful because oftentimes when folks are having certain experiences around their mental health, they feel isolated, they feel alone, they feel that there's no one else that they can really, that really understands what they're going through. So having that peer support I found has been really helpful because it's an opportunity for someone to say, you know what, you're not alone. I've been through this. I've been here before. I felt this way. This is what has helped me. It might help you as well too. Also being aware of the resources that are available, because another challenge is system navigation. And I mean, especially for someone who's a newcomer and who's still getting used to to Canada and to where they are and where they're situated, navigating systems is so difficult. Mm-hmm. So being able to be aware of the resources that are available, if there's any wait lists that are associated, if there's any ways that those things can be worked around, is really important. So at Women's Health, for our clients who are living with HIV, we do, because we provide primary health care as well as mental health care as well, our clients can access that. We still have our own challenges with that as well too. So another piece is advocacy. Sorry, this is my last point. Another piece is advocacy. Really, really important for us to continue to advocate for these services to be properly funded. Because in order for us to be able to provide these services, we need to have, the human resources and everything available to be able to do that. So,
of course, you made a point that's very important. You said that you meet the community members where they are, and that's very important because yes, we're looking at treatment, we're looking at care, but then if I have nowhere to sleep, nowhere to go,
exactly.
If my immigration process is not going through, and that's frustrating, and that's what I came here for, the medication and care and treatment and taking my tablets is on the back burner.
Right.
So it's important to deal with an individual as a whole. And you also made the point of navigating the system and finding out where these resources are. And I just want to add that Hello Ontario is there. And if they go on there, you have so many resources that pinpoints them to different family doctors, different physicians, different points where they can get resources. Even ACCHO's website, right, which is www.accho.ca, where you go to the resources tab and you find the list of resources. I mean, even with the campaign that we're doing, Linking Life to Care, I mean, so many resources are placed out there, phone numbers, addresses, for clinicians, for PrEP clinics, for HIV testing. I mean, you speak about Women's Health in Women's Hand, you talk about APA, PWA, you talk about Black Cap, all of these things are listed there. And so it is just for them to tap in, right, and knowing that that is really there. How do you find it, Irene, to direct persons to the different resources, and do they actually use it? Do you think that after we point them to it, that it's actually works?
Oh yeah. My experience dealing with Black communities living with HIV is they're very we have very high numbers rising of folks facing mental health challenges. So when we are doing the needs assessment, especially for newcomers, they are coming in, they don't have health insurance, they don't have housing. The housing crisis is really hitting so hard to the extent that even the shelter beds are no longer available. So being HIV positive alone is causing you mental health, definitely. You have your drug pill burdens, you're coming into a new country, different culture, different food, different weather. So definitely this is all mental health. So we don't take this for granted. So we work collaboratively with different AIDS service organizations like AIDS Committee of Toronto that provides free counseling. Because these folks are coming in and they're breaking down. They're literally crying. It's a lot going on. It's not only immigration. They're fearing to disclose that they're HIV positive. They're being stigmatized in the shelters. They're hiding their medications because it's a new place. Maybe you're coming from Nigeria, you're coming from the Caribbeans, and you're just here in a new environment. And then also the food, like people are not taking, the adherence is very, very poor. So social determinants to health is very also important. So when we put all this together, we are providing the groups to support these women and all other folks that are living with HIV to cope with their mental health. I think she talked about groups of people living with HIV, where she really got a lot of support in Hamilton. So here in Toronto, we work in collaboration with Black Cap, Upper, and AIDS Committee of Toronto, PWA, to make sure that we bring our folks together, make sure that they are social networking. So we have a lot of groups going on. We are connecting them to mental health therapists, social workers, because at Women's Health, like Natty already mentioned, we have a whole mental health department where we connect our folks. Because sometimes we find out if we go to Hello Ontario and we are sending our clients there, they are having communication problems. The queues for mental health are, I mean, it's a lot. Like you are sending a client to see a mental health therapist and they're telling them we'll see after 9 months, after a year. So I have those challenges connecting my clients to mental health support, because we also have our own challenges. Like we have queues and we can't see everyone, but we do the external referrals. So I make sure I do the warm referrals. If Casey House can't see our clients to support them with the mental health, maybe ACT can do that. Or maybe we can go to St. Michael's Hospital, or sometimes we are collaborating with CAMAGE directly, because sometimes severe needs crisis coming in to support us. And yes, clients are accessing these services and they're supporting them a lot, because if they are dealing with their mental health issues and they're not being supported, they're not even taking their medication. They're not, the adherence is very poor because the person is sleeping on the streets and they're facing mental health. Police is coming in and they're, it's a lot. So we are making sure these people are getting support in all ways, either individually or in groups. We've come up to advocate, like she said, write proposals, get supports for mental health series, where we do groups every quarter to make sure that we are providing mental health for our clients. But we also do the surveys to find out what are the real challenges of their mental health, and also living with HIV, and how best to give them. So they're accessing the services, and it may not be 100%, but they're accessing the services.
Thank you. I'm seeing several hands in the audience, and I know they are burning to ask questions. And so I will switch gear to the audience, and we'll take the questions that they have.
So my question is to Irene.
And I can give you the mic.
So my question is to Irene. I know you touched on mental health, but is it part of each and every patient's routine to be introduced to mental health care? Because I know someone, whether be newcomer or not, the mental strain that comes with this new diagnosis is pretty heavy. Is there any form of mandatory routine or mandatory access to healthcare, mental care rather?
Yes. So we do an intake assessment process when our clients come in. And part of what we do in the needs assessment when the client just walks in is mental health. So the moment we realize that the client is having mental health challenges, we connect them to mental health supports, either internally or externally. Yes, but we do the assessments right on the day one during the needs assessment.
Thank you.
Yes.
Derek, how does the mental health system or setup, do you guys have a department there? And do you guys do referrals? How do you treat with community members who indicate that they need mental support, or how do you guys identify that they need mental health interventions?
So what we do is we have specific days that are assigned for them to come in. They come in and then we, have lunch together, discussion together, talk about their challenges, talk about their needs. And again, we have all, just as you see here in Ontario, we have resources where they can find, where they can go. We even call, make sure we call the agents or the organization where we refer them to. But yeah, we have them and then discuss, talk about their medical, if they have any medical assistance that they need, how they're doing. So we follow up onto them to make sure that they are doing well.
So you have that peer-to-peer sitting,
peer-to-peer
and you also do the referrals, and you actually call the agencies that you're referring them to just to guide them through the process.
True.
So even if you folks don't do it directly, you do those referrals and you follow through to the end.
Yeah, so we deal with other organizations or sister organizations in the New York region.
Right.
At least if we do not send our clients, we do not do that. We make sure that the client is helped.
Yes.
Yeah, if we do not offer this, we're gonna make sure that we refer them to someone who can do that. And we have, booklets, websites, and we even have ACCHO website as well, because it's so resourceful. It has everything. So irregardless of the patient, irregardless where they are at. So, we have resources that we offer to them, and then, they are served.
And that's a true way of linking lives to care.
Very true, yeah. So
beautiful.
Yeah, so we reach folks where they are at, and even if they come to us, we make sure that we are resourceful.
Perfect. Yeah. I'm seeing some more hands there. I see the ladies at the front. Yes.
Thank you. So this is also directed to Irene. So as a person living with HIV, it's something to do with disclosure. Am I obligated to disclose to my employer or to my partner or to my friends or to the people that I live with that I have HIV?
Oh, that's a very, very good question, because disclosure raises so many questions, and we do provide a lot of education on disclosure. And when it comes to Canada, there is law and disclosure in Canada. So we have U is equals U, which is undetectable is equals to untransmittable, where I think it's a whole big topic if I wanted to talk about it, where you may not disclose if you're undetectable, and maybe you need to disclose if you've not been on your medications like for the last 6 months and you're detectable to your partner. Otherwise, if you could be criminalized if you do not disclose your status. That's one. That's with the law. Two, with the people you're living with, disclosure depends on when, how, and the environment also. So it's not mandatory to disclose, because sometimes you may disclose and even turns out to be domestic violence, or even you face stigma. So sometimes when we are providing education to our clients about disclosure, we give them detailed, we provide education on when they can disclose, even to your own children, because sometimes if you're going to disclose your status, you're going to make people who love you or who live around you worry more about you than yourself. So sometimes it's better to give a lot of education to our clients so that they disclose when they feel very comfortable and when to disclose. Yeah.
Thank you for that question. And we have one more question. Find.
Hi. So the question will go to Irene, and it relates to U equals U. I hear you when you say you provide education on disclosure, but do you provide education on U equals U and the significance of it?
Yes, we do. Yes, we do provide education on U is equals U in detail, and we also, with the support of ACCHO, we usually bring in ACCHO so that they can give a whole full education on U is equals U, like I earlier mentioned, because it has the law embedded in it. We do not want our clients to have information that is not clear to them. So we provide a detailed session on U is equals U, even in our ongoing skills building and health promotions. We have a whole Saturday of a session on U is equals U, where we provide the whole education and let people know when can you disclose, when don't you need to disclose. Yes.
Thank you. Fosta, your journey since you have migrated here to Canada seems a bit seamless, right? What are some of the message of hope, message that you would communicate to your brothers and sisters, maybe back home, who are HIV positive, who maybe want to migrate here to Canada? What are some of the positives that you would have identified along your journey that you'd want to encourage those to come on over?
So we still need more, like, we have to live longer. We're not we're normal. Being HIV positive is not a crime. So you have to keep on taking your medication. Be happy. Live your life. Don't shy away from people. I'm HIV positive. I don't have to do this. I don't have to do this. So be open to that person you feel like, and keep on taking your medications. That's what I advise. Right. Because we have to live more and more years.
Right.
Yeah.
And like one of the questions we had earlier that spoke about, if you are deemed to be HIV positive, you won't get your work permit, you won't get your immigration status.
That's a lie, because I'm working. I got my permit.
Yes.
So I have no idea on those words which are spoken, because I'm working. Yes. I got my permit.
Yes.
So what are they talking about?
Right.
It's very old information.
Yeah.
It's outdated information.
It's false. Yeah.
And you spoke about the ease of getting a family doctor as well.
Yeah, it is not hard. So when you're open, you go to the hospital where we get our services. You don't shy away from the doctors or hide, or how will people know that I'm HIV? I'm HIV, yes. I'm normal. I'm same like you. I need services. So if you need a family doctor, I need a family doctor too. So what's the difference? We all human. We need all the services. So I think we have to be open and we stand on what we want. As we're normal, we're not different. Just living with the HIV positive does not make you you have to shy away from people. You don't have to get these services. You don't have to reach here. You don't have to go here. Yeah.
Thank you so much. Derek, I'm seeing a question here online, right? And it is asking, what are the services as it relates to healthcare in your region?
Yeah, well, that's a great question. As for our organizations, we have programs. We not only offer HIV/AIDS support services.
Right.
Yeah, we have reduction and hepatitis C. We do hepatitis C test and awareness. We understand that HIV can come along with different challenges or other diseases, and we realize that hepatitis C can come along as well So we do that service, and then we have actually reimbursed space and then harm reduction. So, and then we, again, I would say we link lives to care. We link lives to care, and we make sure that we offer our best to our clients. Honestly, that's what I would say. And then we have the help of York Region Public Health that offers support to, to organizations like ours. Hospitals are open, and to have such conversations to support the clients with different challenges as well as HIV.
Thank you. Dr. Goodridge, again, has some questions that was posed to him. I know some of the questions were along the line of U equal U and stigma, and so we will cut to Dr. Goodridge just to get his take on some of the questions that were asked to him.
So the next question is about U equals U, or undetectable equals untransmittable. And it's that, can you explain the science behind U equals U and its implications for HIV transmission? So yes, this was a huge finding just in the past decade or so that came out of a couple of major studies. These studies looked at couples where one person was living with HIV but was undetectable and on treatment for at least 6 months, and the other partner was not living with HIV. And what the study aimed to do was to see whether there were any transmissions of HIV from the undetectable partner to the partner without HIV. What it found was that there were 0 transmissions, whether or not condoms were used, with different types of sex, between the partners in the relationship. So this study gathered a lot of data and really definitively told us that sexual transmission of HIV is not possible if you're undetectable and have been on treatment for at least 6 months. This was game-changing, and I think this has done a lot to help reduce some of the stigma that's associated with HIV. But of course, a lot of education still needs to be done to pass this message on to individuals who may not know this, may have not been educated around this principle. That being said, there's very few times in medicine that physicians feel comfortable saying that the risk of something is 0. And this is one of those times. The next question is about what's required for someone to achieve and maintain an undetectable viral load. And this can usually be attained within the first weeks of treatment often, with a lot of our first-line treatments these days. So our treatments tend to be quite potent and quite effective. And in order to maintain an undetectable viral load, it's important that you take your antiretrovirals or your HIV medications as prescribed. So for instance, that may be 1 pill once daily, that may be an injection every 1 to 2 months. But it's important to just take it as prescribed to help keep the virus suppressed at low enough levels that the virus can't replicate, that it can't make more copies of itself. That being said, also talk to your physician about whether there's any drug interactions between your treatment and other medications. An example is Tums, has calcium or calcium carbonate in it, and that can interact with some of the oral pills that we use for treating HIV, for instance. The next question is, how often should someone on HIV treatment get their viral load checked? And this really depends on how long it's been since they've been HIV positive, or how long after it's been detected, how long they've been on treatment for, and what their previous lab values have looked like. So soon after diagnosis, we often measure viral load every 1 or 2 months. Then once it's undetectable, we measure it a bit less frequently. Once the person has been undetectable for a period of time, they've been taking their medications as prescribed, then we only really have to measure viral load every 6 months. And again, if they take their medications as prescribed, we don't really see an increase in this level. So most patients can get away with getting their viral load tested just twice a year. The next questions are about adherence. One is, why is adherence to antiretroviral therapy so crucial for people living with HIV? And so I alluded to some of this when I was talking about how undetectable equals untransmittable. How if you're undetectable, you won't be able to transmit HIV through sex. But we also know that keeping an undetectable viral load helps keep your immune system healthy because the HIV virus otherwise can attack the immune system. It helps keep the virus low enough that it can't develop resistance to our treatments, right? And it helps prevent some of the adverse effects that a chronic infection like HIV could have in different systems in our body. What are the potential consequences of missing doses of ART or antiretroviral therapy? So, the first thing I tell people is, let's say you're pretty good at taking your medications and maybe you forget to take it at the same time every day, but you remember to take it later on that same day. That usually won't lead to any significant issues. So I reassure people about that first and foremost. Now, if you miss a dose once every so often, infrequently, it usually doesn't make a big difference. But let's say someone misses their medications, at a frequency of a few doses a week or something, then that can have some implications, right? The viral load can go up. They may develop resistance to some of those treatments. And that's something we really want to avoid. And so that's why we make sure to really stress the importance of adherence and to work with you to determine how we can help maintain good adherence, really as close to perfect as possible when it comes to taking your medications. So some people recognize maybe they aren't the best at taking a pill every day, right? Maybe they need reminders, maybe they need visual cues, maybe they hold their medications with them. But some patients also opt to switch to other options, like, for instance, injectable antiretroviral therapy that can be given every 1 to 2 months at a pharmacy or at a clinic. So knowing your options is helpful, and knowing what type of person you are and what treatment might work best for you based on your own schedule and other obligations is really one of the most important factors we make when we decide, or we use when we make this decision. The next question is about highlighting the pros and cons of daily medication versus long-acting injectable treatment. And what are the criteria for being eligible for injectable treatment and why? So I think I alluded to this a little bit in my last answer, that 1 pill once a day, long-lasting injectable, both very great options and is an individualized decision. Some people don't mind taking a pill every day, and it's easy for them to get to their pharmacy every few months to pick up a few bottles worth. Others don't mind going into a pharmacy or into clinic, which takes some time, until the injection's ready and until it's administered. But I know that some people like knowing that the drug is working in their system. They don't have to worry about, did I or did I not remember to take my pill today? And some people also say they like the injection because they don't have to see the pill or the daily reminder of their HIV. Instead, they live normal, happy lives, forgetting about their HIV diagnosis most of the time, because it's not really affecting them, right? Once they're undetectable, once they're stable, they know their body systems are good to go. So some people actually like the injectable for that reason, but again, a lot of different factors go into that decision, right? Now the question about what are the criteria for injections, in order to currently access injectable antiretroviral therapy, you have to have been undetectable on other oral treatments for a period of months before switching over. There are a few exceptions we might make to that rule, but generally that's what's recommended. And the reason being is that this injectable treatment was mostly studied in patients who already had undetectable viral loads before switching onto it. Now, in the future, we might get more data, more studies looking at injectable treatment for those who are detectable. And so we might be able to recommend them in more populations than that. The last couple of questions are about mental health. One, how does living with HIV impact mental health, and what support is available? So we know that a lot of implications on mental health are related to the stigma that surrounds HIV. While the stigma has somewhat decreased over the years, we unfortunately know that it's still present. that there's biases that people have, negative attitudes or beliefs about HIV that are often misinformed, and that can lead to patients with HIV feel shamed, feel upset, feel unwanted or unheard. And that can be devastating to mental health for some individuals, right? So we see relatively commonly symptoms in depression and symptoms of anxiety, although other conditions can also occur. Some people, notice that these symptoms last all day, and some will maybe have it only triggered when there's negative interactions with others, like when seeking out sexual partners who they may find, project onto them or reject them for one reason or another. Patients talk about some social isolation as well, which is why we really recommend connecting to others in the communities that you identify with or are part of. That may be others living with HIV, that may be others in the similar racial communities, religious backgrounds, gender identities as you. So having a strong social network we know is very supportive for mental health. And we also know that there's specific resources tailored to individuals living with HIV. Things like certain support groups, certain HIV psychiatry clinics, like the one at St. Michael's Hospital here in Toronto. But in some cases, patients may have symptoms where they necessitate or where they may benefit from taking medications to help treat some of these underlying symptoms or conditions like depression or anxiety.
Thank you so much, Dr. Goodridge, for that. I liked how you touched on those various questions and just shed light on it. So it's way clearer to us than it was before. I want to jump over to Natasha and find out what's the process like for testing out there in the communities.
Yeah, so as I mentioned before, we use a rapid anonymous point of care test, which you receive your results in seconds on the spot.
Mm-hmm.
It's done on the person facilitating it is a certified tester, so that would be me.
Right.
Or some of the peers that we've actually been able to train to do that as well. So we offer pre and post-test counseling with the test. The pre-counseling is an opportunity to get some more information about person's individual, whatever activities that may pose a potential risk for transmission, to provide some education around HIV, around U equals U, around PrEP and PEP and PIP. And also to check in with them to see what their supports look like, what type of support systems they have in their life. If they were to find out that they were positive, who would they talk to, if they have any fear or anxiety around doing the test. And we want to ensure that we're providing those results with someone who is in a space to receive them. We don't want to create more harm by giving someone results who may not be ready to receive them and may harm themselves because of the results that they receive. So it's really important for us to really take the time to provide that counseling to them in the beginning of the session. And then give them recommendations based off of the counseling that we provide. Then we administer the test, and then based on the results, we do some post-test counseling with them. So if they're HIV negative, then providing information and strategies on how they can remain negative. And if they're positive, talking about things like disclosure, how we can get them linked to care, and any other things that they would like to discuss during that time.
So you not just test them, but you prepare them before, right? And then you prepare them afterwards, how to link themselves to care, right? And even if they are negative, then how to go and PEP or PEP, right?
Right.
Beautiful. Derek, you are in the York region, right? If somebody's moving from Toronto and going to the York region, do you guys take referrals? How do that transition looks like for somebody moving from out of the city and hopping over to the York region?
Well, I must say we previously known as the AIDS Committee of York Region. Why it changed to Be Care, it's because of the stigma behind that statement.
Right.
So it changed to become Care. Mm-hmm. So we take on referrals regardless where someone comes from. And we make sure that clients are catered for in every need. So even if you move to your region, you shouldn't be worried about, how is it gonna be, how am I gonna continue with my medication? Yeah, we receive referrals, and our goal or our mandate is to make sure that we care for people or find them where they are at.
Can they Google and find you guys? You want to share the address, the phone number for you guys that they can access these services if they do wander to the York region?
Oh yeah, we have a website, www.cayr.org, and we're found in Newmarket, Leslie Street. The address is 17665 Leslie Street, Unit 12. So we have Twitter, we have Facebook, we have Instagram. Our services, our programs are listed there. You can Google us and you can find us. Nice. So all the services that we offer, amazing team, our team is, listed on our website. So any questions, we're there to answer.
Lovely, thank you.
Yeah.
Irene, over by Women Health in Women's Hands, how do you deal with stigma with the ladies there when they complain about the stigma being faced and that particular barrier? How do you navigate them through that?
Right from the onset, when the women come in at Women's Health and Women's Hands, we provide them with limits of confidentiality. We assure them with confidentiality and let them know that whatever goes on at Women's Health stops at Women's Health. We don't share anybody's information. And also we have communities that are really facing self-stigma. I had someone ask about self-stigma, internal stigma. Yes, we reach out to those communities. We are providing private groups and sessions to make sure that we are reaching them at where they are and where they can access services, and not denying them that the fact that they are facing stigma and denying them the services.
Right.
And yes, we have these communities that have a lot of stigma and don't want to come in, but we go out and provide the services where they are.
And if somebody wants to find you, to find Women Health in Women's Hand, how do they go about finding and connecting and just doing that intake to really find out what they really want?
Oh, that's a very good question. So how our referrals come to Women's Health? One, we get the referrals from the immigration panelists. We get the referrals from public health. We get the referrals from peers, our community members will say, go to Women's Health, they're very good. They will see even when you don't have insurance. And then we also have the walk-ins. People will just walk in, but the best also way would be like visit our website at Women's Health in Women's Hands. We also have the Instagram, we have the Twitter, we have Facebook. You can actually go to our website and download the intake form and fill out the intake form. When you are an African, Caribbean, and a woman that identifies as Black, and you're HIV positive, you're pregnant, and you're transgender or transitioning, you're a priority group. So we make sure you're connected to care in the next 48 hours. Yes.
Thank you. Fosta, you made mention earlier that just when you arrived, you were afraid, you were not as bold and confident about disclosure, right? You made mention when you were doing your medical for immigration, you left the section for your status blank. You made mention when you went into the housing, right? The shelter, that you didn't tell them that you're on medications, right? And I guess that was because of stigma being faced back home. But then eventually, you had to disclose because you were then running out of medication. You just wanted to apply for your work permit. You wanted care. You also shared that it wasn't so hard after all, after disclosing. I want you to share with those who are watching us online. I want you to share with those who are here in the audience tonight the importance of also disclosing when you actually disclose, and where that would have taken you from skipping out the sections on the form, hiding your medications to where you are today.
So, ladies and gentlemen, I'm advising you who are here and watching us online, disclose, don't fear, be open, because if you disclose, you get access to people, you get access to your medication, you get access to many things. So if you hide and don't disclose, you will miss many things. Like, because for me now, I'm open. I go in groups of women. We go out. I get my medication. I talk to my doctor. You know what? I'm tired of these pills. Why don't I switch on to this? So if you have, when you disclose, you free, you open, you feel like, yeah, I have somebody to talk to. You don't live in fear. Like, yeah, it's good to disclose. That's what I advise you. You'll feel peace in you.
And I mean, it opens up doors.
Yeah, everything is like you're not, you feel like, yeah, I'm not alone. I'm normal like other people. So you get the services. But if you hide, you'll not get your medication. You'll not get to know good people around you, because now the groups I'm in, if like I'm down, I have somebody to talk to. Please, you're not alone. We're here for you. But I could not, like, if I didn't disclose, I could not know them. You get me? Yeah, be open, disclose. You get to know good people. You get access to many good things.
Thank you.
Yeah.
Thank you so much, Fosta, for sharing.
Yeah.
Derek, what's your closing remarks to the folks in our community, our African Caribbean Black folks, as it relates to linkage to care, and what's your final word to them?
Well, I want to say, it comes with lots of challenges to some people to know you're HIV positive. As Fosta said, it's not the end of life.
Right.
I must say that. That's not the end of the future. There's a lot of support out there that can be given out to you. As I said, once you accept it, now we're gonna find the solution. And organizations are many, and they're here for you. I understand this comes with depression, but when you do not accept, when you fall down, all you have to do is to get up. Yeah. So once you get up, we shall find you. And I believe we're here for you. So if you've had all these organizations, websites, any name, there's still hope for a better life.
Thank you.
Again, I am from Care Community Connections, found in Newmarket, Leslie Street.
Thank you so much, Derek. Natty, you have been doing the work for years, and you continue finding the passion and the energy day after day to serve the community members. And tell us why you continue, and that one message to our community members, why they should access care as you link them to care in their daily commute in the community.
Mm-hmm. Yeah, I think the message that I have for folks is that there's power in knowing your status, knowing whether you're negative or positive, because we all have a status, right? Mm-hmm. So there's power in knowing that. And there's power in sharing that knowledge within our community, making sure that things are accessible to our community. There's power in that. Too many of our community members are disproportionately impacted by HIV and AIDS in Canada. And so it's important for me to continue to push the knowledge forward. Because with that knowledge and awareness, then we can start to really fight back against stigma, because oftentimes stigma is rooted in a lot of misinformation. It's rooted in a lot of inaccurate information, a lack of awareness and a lack of knowledge. So if we continue to, be voices for our community and continue to just push that information out there, then to me that's a way of helping to reduce stigma, and also providing that opportunity for ACB folks to really take control of their sexual health in their lives.
Thank you so much, Natty. Thank you. Irene, you have been there for years in the community, passionate, an advocate, a true advocate. What are your final words that you would leave with a community member here tonight?
Yeah, my word tonight is, since we've all talked about testing and knowing our status, which is very important, I advocate for proper adherence. We cannot talk about you is equals you when we are not adhering well on medications. So my take home today would be, let's adhere very well on medications so that we don't talk about undetectable is equals to untransmittable, not only to your partners, but also to your unborn babies. In this day and era, we should not be having little babies born with HIV. Let's adhere on medication.
Thank you so much, Irene. Thank you. I appreciate that. What a night it has been. A really robust discussion, and a lot of education, a lot of knowledge have been pushed tonight. And I just want us to digest them and access care as we link you to care. What is important to me is that we're still having this conversation. We're still building, we're still supporting our African Caribbean folks. And to know that we're not alone. We're not in this fight alone. We're all in it together in one way, shape, or form. Whether we're positive, whether we are negative, we continue to support our brothers and sisters here in the Black community. I also want to note that the views and opinion expressed are those of the participants here on After Dark Chat and not necessarily reflects the views and opinion of ACCHO. I want to especially thank the live audience for joining. Make some noise in the audience. I want to thank the panelists who would have come and shared with us from both segments, segment 1 and segment 2. We really, really, really appreciate you, and I thank you and I big you up on behalf of the viewers online. Thank you for coming. ACCHO will be looking at treatment and care in our Linking Lives to Care campaign. We are at our second pillar. And so we looked on prevention previously, and now we're looking on treatment. We're looking on treatment and care. So I want us to follow our Instagram page, right? Follow our YouTube channels, or LinkedIn. We're on almost every single platform, and look out for the new content that'll be coming out on treatment and care. And click on the link in our bio. Right, it gives you all the resources to find doctors, to find where you can get your medication. The whole works is there. So take advantage of the different resources that we are offering. We also have our website, which is Hello Ontario. You can visit there. You can Google it. You'll see it. You can visit at ACCHO, www.accho.ca as well, and you see a number of resources. I want us to take advantage of that. And if you know a friend or a friend of a friend, you can always share either the websites or a social media handle, and you can find resources in the entire province, not just Ontario, but the entire province, not just Toronto, but the entire province of Ontario. It was indeed a pleasure having you all to join, and I want us to just give ourselves a big hug, a big clap to say that we are still doing this. I could not do this alone, so I just want to thank Team ACCHO out there that works behind the scenes all the time. You have Kirel, you have Lenandro, you have Etsy who works, and big up to our strategy workers, our 15 strategy workers right around the province of Ontario. I could not do it without them. So thank you all for